this is a big surgery, and to go through it by yourself is probably very difficult. You have to do a lot of physical therapy afterwards, so yeah, people helping you get to the physical therapy appointments, the doctor appointments is great. People helping you at home doing your exercising and encouraging you. We've had patients come in and say, yeah, they don't feel so comfortable doing exercises, but their family will really push them and get them to do their exercises, and then they'll have a better result. You need to support them and not get upset with them, because sometimes they'll notice something like a family member or a physician or your physical therapist to help you out. So if you have friends, that's sometimes just as good as having family around. I think family and friends are very important in your overall well-being, and especially after a big surgery like hip replacement or knee replacement. Whether or not you have family or friends, or it's the nursing support or the nursing home you go to or the physical therapist, yeah, that's all very important to help you get through this very stressful time. And you gotta appreciate them and understand that they're probably just trying to help you out and making sure you have the best result possible.
This is a big operation, whether it's a hip replacement or a knee replacement. They are big operations. There will be some pain involved in the post-operative period. And so I think it's unrealistic for patients to have expectations that they will have no pain. So I think that going forward, we will do our best. You will have IV medications after surgery as well as oral medications, with then a transition upon going home to oral pain medications. But I think patients need to realize that they will need to take the pain medications, and they may have worsening pain with physical therapy, and it's okay to take extra medication with therapy if you start having pain. And then each day the pain will get better. But I think it's just important to recognize that the post-operative pain, the pain that's obviously going to be the most severe, usually by the time people come into the office between 1 or 2 weeks, they're feeling quite a bit better. They're able to transition from a walker to a cane or things like that. But I think it's reasonable to say between 4 to 6 weeks before they're really feeling well and not having to potentially take any pain medications. One of the things, I think the biggest things that can help the recovery process is physical therapy. I personally just have had good results with people who have gone to therapy, done their rehabilitation exercises and turn them into prehabilitation exercises or before. Then their muscles are stronger, they know what to expect, and it gets them ready for the surgery. And I think those people have an easier transition into the recovery phase. The more fit you are, the stronger your muscles are, I think lead to a better outcome and potentially a quicker recovery.
Proper dressing care and maintenance is very important to help prevent infections and make sure that your wound heals appropriately the way it should. With the joint replacements, you'll typically have one of two different dressings. The one that we like to use is the OptiFoam, which is silver impregnated dressing. It has natural antibiotic qualities to it. Those can be left in place for 7 days. You don't really have to do anything with them. You just don't get them wet. No bathing, no hot tubs, no showers like that. It's all going to be like, like bed bath, with a washcloth, that sort of thing. And the main thing is just monitoring the center pad, which looks kind of like a white sponge, monitoring that for drainage. And if the drainage approaches the edge of the sponge, then it needs to be changed. And that's a simple thing to arrange. All you have to do is call our office and we can get you in and just have a dressing change done. The other type of dressing is a more traditional with like abdominal pads and Curlex wrap. And that typically will go on somebody that was having a lot of drainage in the hospital, and we felt that they needed more absorbency than what our OptiFoam could accommodate. And those can be changed daily. They should be changed daily. Typically the nurses will instruct you on what supplies you need from the pharmacy. You can get all the stuff from the pharmacy, and you'll just take the old dressings off, toss them in the trash, and put the new dressings on your incision site. and use whatever tape or wrap is appropriate for your skin. Some people have tape allergies and have to use like a Coban wrap or an Ace wrap to hold it in place. But the thing with those dressings is that they do have to be changed every day. They still can't get wet. Pretty much you want to stay away from water or anything that can soak into a dressing when you're in your post-operative care stage at home. Typically you'll be doing dressing changes until your staples come out, which is at the 2-week mark, and after then it's safe to take a shower. We still don't want you to submerge your wounds in like a swimming pool or a hot tub until all the scabbing is gone and it's scarred over. They can change their own dressings if they feel comfortable doing so. Our floor nurses at FHN are more than adequate to teach you on how to change your dressing and teach your family members if you require assistance. But if you need home health care services, all you have to do is identify that to us and I can order it or one of the doctors can order it.
The role that the patient plays is probably as important, if not more important, than the surgeon. I've been doing this for over 25 years, and I've done thousands of operations on patients with joint replacement. The biggest variable by far, it's not the surgeon, it's not the implant, it's the patient and their motivation. Those patients that are most accountable, that work the hardest and do what they're asked to do, get the best results regardless. And if you understand that ahead of time, which we try and do with our patients so that they know what to expect, it really enhances their outcomes so that they have the best probability of getting a good result as quickly as possible. That means you need to be educated enough to know what to expect. You need to be ready from day one when you come to the hospital to participate and work hard to achieve your goals as quickly and efficiently as possible. Actually, it's a whole team, but mostly post-operatively it's going to be the physical therapists and your nurses on the floor. The therapists will go over this almost all the time prior to your surgery so that there are no misconceptions or misunderstandings about what you're expected to do. I think the most important thing is to recognize that regardless of what your outlook or demeanor is when you start the process, is that you have to listen to what you're told by the therapists that are working with you. And even if you're not that psyched up or motivated to necessarily do what they ask you and you still participate, you're going to wind up better off than if you don't.